Good afternoon, everybody. My name is Kristi Ford-Scales. I'm the Spartanburg Medical Director at Hospice here in Spartanburg, South Carolina. I'm a family medicine trained physician who lives in Union, South Carolina with my family, my husband Matt, and my 3 children. And I have a deep passion for advanced care planning. And so that's what we're going to be talking about today. And I hope during this talk you have some questions answered. You'll learn a few things about advanced care planning that you can use going forward, and that you will be able to glean some good information. So I want to start today with a story, if that's okay. So a couple of years ago, we had went to a movie, me and my family. And during this movie, it was a superhero movie about the Avengers. If you don't know anything about the Avengers, they were a group of superheroes that fought off all the violence and crime in the world. Great movies for a young child and for a grown woman. So I am going to spoil part of the ending, however. At the at the end, the very last movie that we went to see, one of the main characters, one of the superheroes, dies. On the way home that night, we were driving home back to Union. I look in the back seat and my son is sitting there and he's crying. And I said, "Buddy, what is wrong?" And it just big tears were in his eyes. And he said, "Mom, it's just so sad. Even Iron Man dies." And I thought, what a life lesson for him that I was not expecting to have during an Avenger movie. But it is true. Everybody dies. And us as Americans, we don't like to accept the fact that that is a commonality between all of us that we will each go through at some point. But what if I told you that you do have some control in this process? The who, what, when, where, and why of death, there's a lot of unknowns. There's a lot of things that are beyond our control. The only thing that's definite is the who, and that's me and that's you. The other parts of it, there's some of those things that we can exact control over. And we can give a gift to our family and our loved ones around us by expressing our wishes and telling others what we want at the end of our lives. Advanced care planning is just a long, fancy term that basically means an expression of your desires and wishes for what you would like at the end of life that is expressed to others around you so that they can exact that if you're not there or if you're not able to make that decision for yourself. I'm going to walk you through a stepwise process to help you develop your own advanced care plan. We will go through a couple of different steps that some will be easier than others that may be harder. But the first one we're going to start with is step one is think. This might be the easiest I ask you to do. So what I want you to think about are your values, your wishes, and your beliefs. The first thing we talk about is our values. When you think about yourself, I want you to think about what makes you happy. I want you to think about what gives you peace. When you think about a good life, what do you think about? Those are all core values that we hold dear. I don't know your core values. I don't know my husband's, my children. I can guess. Those closest to me, I can guess a little bit better. But at the end of the day, we know our own values and we need to communicate that with others. What are your wishes? When you think about the end of life, what do you hope and wish for? What would make that look good to you? The number that I often think of is that around 74% of people express that they wish they would die at home. Only about 34% of people in America actually do. That's a big gap in a number. We want to see the number of people who actually get to die at home increase if that's their desire to do so. And the only way we can do that is to have our wishes expressed to others around us who will have that control at that time. What about your beliefs? Some of us hold our spiritual and our religious beliefs very dear to us. Others don't, but only you know. Some of the things you believe will affect your entire life, especially the end of your life. Some of the medical treatments you're willing to take, some you're not. All that is affected by what we hold at the core center of ourselves and our beliefs. The only way that others around us know that is when we express that to the people who are most important to us. So the first step we're going to go through is think. You can do that now. You can take some time later, but really think about these core things that you want to express to others. The next step might be the hardest step, I will admit, and it's to learn. You need to learn certain things about yourself and about medical care in general so that you can make informed decisions about end-of-life measures. The first thing you need to learn about is your overall health. I'm often shocked a lot of times when I'm talking to somebody about their health, and I'll ask them why they're on a certain medication and they can't answer the question. They don't know. You need to know exactly what's going on with your own body at this time. The only way a lot of times that you're going to know is by asking questions. The medical field always has your best interest at heart, but a lot of times our communication skills can be lacking, and it can be a one-way street. If you come prepared and ask questions of your primary care provider or the specialist that you're seeing, you will be able to get a better idea of your overall health picture and be able to communicate that better to those around you, your family, and your friends. Do you have current conditions that you want to better understand? Are there certain things that you have questions about? I always remember one of the stories of when I was training, I was working in oncology with cancer patients. And one of the oncologists said, I've been treating this young man, 20 years old, for testicular cancer for several months. He had went through a couple of different rounds of treatment with chemotherapy, and he was actually facing a bone marrow biopsy. He walks in one day and he says, I just have one question. Can you tell me exactly what cancer is? So they had been on this trajectory for so long, and the basic question that probably needed to be asked hadn't been asked, and it hadn't been communicated. He was able to then, at that point, understand the disease that was going on in his body in a cellular level to understand why he was needing these different medical procedures to be done and what they were actually doing to his body. That is a level of understanding that helps you make decisions in a broad spectrum way. And that's what we need. When you understand what's going on exactly with your body, then you'll be better able to understand why and when you would need to use emergency treatments. Now, there's several emergency treatments out there. Some of the big players are listed on this slide. Ventilators. A ventilator is a device, a machine, that is placed inside a patient to help them breathe when they're unable to breathe on their own. Ventilators can be used in several different instances. They can be used in surgery when you're under anesthesia and you can't breathe on your own. It helps you breathe until you come out of surgery. They can be used in accidents when you've had a lot of trauma and you need a break for your body to heal. And so the machine breathes for you so you can heal the other parts of your body. But ventilators also can be used in situations where the patient has pretty infected lungs, pretty severe lung disease, and they're no longer able to breathe on their own. In each of those situations, the likelihood that the patient can come off of the ventilator and breathe on their own and not need the ventilator is different. So in a surgery, it's pretty likely you're going to be able to come off the ventilator once we stop the medicines, compared to if you have severe lung disease and you're placed on a ventilator to help you, that likelihood decreases. You need to know your own health conditions to be able to make that decision if you would actually want to be on the ventilator, if you knew that your chances are different of you being able to come off of it compared to someone else. CPR is another emergency treatment that we all know and love. Cardiopulmonary resuscitation is a technique that is used for people who have had a sudden cardiac arrest and need to be resuscitated. We have an idea, I feel like we have an idea in America of CPR that may be a little different than the actuality. We see CPR a lot of times in movies and on the TV screens, on the different medical shows. And you see somebody who has a cardiac arrest on the screen, they go out, someone comes in, they start CPR, and the person wakes up and walks off screen, you know, and you think, wow, that really works. In all actuality, CPR is a good technique that's needed and is used, but the likelihood of survival is not quite as good as you may be led to believe with movies and television. In fact, only about 12% of people who undergo CPR when they have a cardiac arrest outside the hospital actually survive. And I'm not talking a survive where they return to the baseline they were before the cardiac arrest. I'm talking about living to the point of getting to the hospital. If a patient has a cardiac arrest inside a hospital, we call that code blue, and the code team comes to resuscitate the patients, the likelihood of survival goes up slightly to around 24%, but obviously those numbers are not as high as we may be led to believe. The numbers are different for different types of people. If you're completely healthy when you have CPR done for you and you just had a cardiac arrest, that's a little bit different than a patient who is elderly, has several medical conditions, and is going to undergo cardiac resuscitation. Those two likelihoods of survival are very different. And you have to understand your own body to be able to understand the likelihood that you would be able to improve. Also, when you see CPR on the movies, it's a simple technique, not a lot goes into it, and they move on. I just this morning, had to recertify myself for CPR. The way we do that here is we have mannequins, and we have to resuscitate the mannequin, and then the computer scores us. I had to do CPR for 2 minutes on a mannequin. You have to press so hard that you actually feel bone contact, pretty much. I did it for 2 minutes and I was sweating by the end of it. That's how much effort goes into CPR. So with that in mind, a lot of times people will say, actually, I don't think that I would want that, because at this point, you know, I have so many medical conditions going on that I don't want to have to undergo that procedure. So that's something you have to think about. Artificial nutrition is another hot topic. Artificial nutrition is basically where we are giving a type of nutrition into the body that is not through the natural process of eating, swallowing, and being able to take it into our own stomach. Most of the time, this is done by a tube placed into either the nose or in the stomach somewhere that will be able to take nutrition in that is man-made. In some situations, artificial nutrition is actually very beneficial in children who have cancer, in HIV or AIDS patients, or in adults who have head and neck cancer and they're having treatment on the tumor and it's impinging on their ability to eat and drink at that time. A lot of times in those situations, artificial nutrition has been shown to actually help. But in other situations, it has not. In the demented patient who has lost the ability to swallow correctly, because the swallowing reflex is actually a very complicated reflex to have. When the demented patient is no longer able to swallow correctly, and we place a feeding tube in that type of patient, actually the risk of that feeding tube outweighs the benefit. What I mean by that, they increase their likelihood of infections, of aspiration. They increase their likelihood of agitation in that situation, and there's no evidence at this point that it actually prolongs their life. So knowing your body, knowing your own medical illnesses will help direct you on if this feeding tube or artificial nutrition would be appropriate or if it wouldn't. Comfort care is obviously, me working in hospice, we deal a lot with comfort care. It's a loaded term that a lot of people don't understand. Comfort care is when we start to focus more on the symptoms of a patient instead of the cure of the patient, because sometimes the cure can be pretty uncomfortable for whatever medical condition you have. People can choose to have treatment, but instead of having a curative treatment, we pursue comfort. So pain, nausea, vomiting, seizure activity, any of those symptoms that are pretty burdensome, we can focus on controlling that symptom instead of trying to treat whatever is causing that symptom. So if they have a cancer, you can decide to stop the chemotherapy because it's causing more problems and focus purely on helping the pain that is caused by the cancer. That's comfort care. Not all comfort care is hospice. Hospice is for patients who have less than 6 months to live and they desire comfort at the end of their lives. There are people in the hospital right now who are not on hospice who are getting comfort care. They're getting symptom control at this time for whatever symptom is presenting. So it can be a loaded term, but we just have to know the differences between the two and if we would want it or not. The next step we have is a decision. When you think about what you want, what you desire, what your values are, when you learn about yourself and what is going on in your body or what is not going on in your body, and if you would want certain emergency treatments, then you have a decision to make. You need to decide on a few people who you would be willing to talk to about this and who you would want to speak for you should you not be able to speak for yourself. We call that a power of attorney. Now, these people, the only rules for this person or these people is that in the state of South Carolina, you have to be over the age of 18 to be able to be a power of attorney, and you can't be somebody that is actively involved in healthcare of the patient. So it can't be your doctor or your stay-at-home nurse. It has to be somebody that would be more neutral to the situation. Those are really the only rules that we have. Other than that, the world is yours when it comes to that decision. But I will offer some suggestions that you want your power of attorney to be someone who understands your values, your wishes, your beliefs. You want to be somebody that you understand will advocate for you should you not be able to talk. And you want someone who will agree to do the said things above. Once you've decided on those two people, you want to be able to speak with them, to be able to openly communicate with them all that we've talked about before and have them understand completely. So once you've done that, you've thought about it, you've learned about yourself, you decided who you want to help you, should that time come where you're not able to speak for yourself, then you're going to start talking. You're going to talk to that person about your beliefs, your values, your wishes, and you want them to be able to exact that. You want to talk to other people around you, your family members, your friends. There's a lot of people involved in your life that you probably don't even realize. You want the major players to be on the same page about what you want. We describe that as a gift. You're giving a gift to those around you. You're taking some of the pressure off of them to have to make decisions in your stead when they don't know what you would want or what you desire. And then you also are going to want to talk to your healthcare provider, the person who will be more than likely exacting the care for you at that time. All the major players need to be involved. They need to have open communication. And honestly, a lot of times it may seem awkward at the time, but it's not, and it's a gift. Like I said, it's a gift. I've heard somebody say before, it's like the birds and bees talk that you have with your parents when you're growing up. You talk about it really fast and you don't talk about it anymore and you just hope, you all forget it. It's not that talk at all. This is a talk that has to be open, communicative, and can happen several times. You're able to change your mind. Your values, your beliefs, and your wishes definitely can change. I always say that the person I was 10 years ago and the person I am right now are pretty different people. I will say that some of my values, a lot of my beliefs, and some of my wishes have changed, and that's okay. But we have to be able to talk about those changes as they go along and be able to communicate that with all of those around us. The next step is probably the step that brought everybody here today, the recording of your wishes. You want to be able to record and write down exactly what you want so that it can be exacted the way you desire it to be. You can do that a couple of different ways. You can have an advanced care planning guide. You can write a letter. You can make a video or audio recording so that somebody else can record it or can write it down for you. There's several different options for your ability to do this. I will say in the state of South Carolina, we do have a couple of different forms that can be used. One of the forms that is nationwide is called 5 Wishes. It's a pamphlet that walks you through different values, beliefs that you have so you can write them down. And so you can use that as a guide for advanced care planning. There's also a game. It's called Hello. You can Google Hello game. And it's a game that you can use where it's a card, asks you a question, and then you go around the table and answer the question. You can do that with your family, and that can be a way that you get your different wishes and beliefs made out. I play the game. It's, for a person like me, it's great, but but you may not think it's as fun. I think it's great. But there's different ways to do that, but you definitely want to be able to write it down. You need to have a hard copy of your desires and wishes so that you can be able to bring that with you whenever you're going to your healthcare provider or whenever you go to the hospital. And you want your power of attorney to have a copy of it as well so that they don't have to just recall memory the conversations that you've had. They can be able to read whatever you've written and know that they're making the right decisions at that time. So how can we help? We have certified advanced care planning facilitators at this number listed below. We also have a website that you can see, spartanburgregional.com/directingyourlife, and they have several resources. A couple of these I will talk about. We have the South Carolina Healthcare Power of Attorney document. Now, the Power of Attorney document is the document where you will list the person and or people that you would like to be able to help you make your decisions should you not be able to make your own. I will make a caveat here. There's the healthcare power of attorney, and there's also a different, the financial power of attorney. Those can be the same person or those can be different people. You have to name one for each. They're not the same. So once you name a healthcare power of attorney, you're going to have to also have a financial power of attorney. So right now we're purely talking about the healthcare power of attorney. A living will document is slightly different than the power of attorney document. The power of attorney purely names the people you would want. A living will is going to go through some of the different emergency treatments that we were talking about earlier in this talk. And it's going to ask you, would you want this or would you not? And then you just would mark if you would or if you wouldn't. And that is a document that can be used by your power of attorney once you're not able to speak for yourself anymore to be able to exact your wishes. There's also a conversation starter kit, like I was talking about. You have your games, the hello game, you have the 5 wishes. We also have a starter kit that can help you sort of think of ways to bring up the conversation. And we have some commonly asked questions on that website that you would be able to look through. So I will also go back to the South Carolina Healthcare Power of Attorney just for a second. I will say, so let's say you don't pick somebody. Let's say that you don't get around to it and nobody is named. There's a law in South Carolina called the Healthcare Consent Act. You will go under that law should you not have a power of attorney named. It's a chain of command. And basically if you're bored and you have some summer reading to do and you want to Google it and pull it up, by all means, I'll give you the Cliff Notes version of it. The chain of command basically goes, first of all, if you have a court-appointed guardian, that person would be the person who would be your power of attorney. If after that you don't, and you have a spouse, the spouse would be the person who would be your power of attorney. Now, I will say, if you're separated and not divorced, legally divorced from the person, they still have power of attorney should you not be able to communicate. That's very important, especially for people going through a separation to understand. If you don't have anybody else named, it would be that person. The next would be your children, adult children over the age of 18. If you have several, it would be a consensus of those people. So if you have 5 children, you would have to have 3 agree on a measure to be taken for you and your health care, and then that would be exacted by the medical team. After that, it goes into other family members. So your parents would be your next step, and you'd have to have majority rules, or brothers and sisters, and you would have to have majority rules from that as well. And it flows from there until eventually you would get to a friend. So if you have no one else in the chain of command, eventually it could be to a friend, but the friend cannot be paid to be your caregiver and cannot be a medical care provider for you. So that's a quick walk through the Healthcare Consent Act, but I did want to touch on that. If you didn't name anybody for your healthcare power of attorney, you would go under that act. And like I said, you can Google it and look it up. So I want to thank you so much for joining us and for talking about advanced care planning with me. Some people had submitted a couple of questions for me before, and so I want to go through those quickly and answer the questions. So the first question is it true that an advanced care plan is only for people who do not want life-sustaining treatment? No, that is not true at all. So an advanced care plan is a way for you to communicate how you want your death to look. Anybody and everybody needs an advanced care plan. Now, like I said, it may change. The advanced care plan I have now for myself and that I've talked about with my husband may be very different in 10, 15 years. If I'm diagnosed with a different type of illness, it may change. But everybody needs to be able to have that communication with the major players around them and be able to have them know exactly what you would want should the time come where your death is imminent and you're not able to speak for yourself. If you don't want life-sustaining treatment, or if you do, can be recorded in that advanced care plan. So what is the difference between a medical power of attorney and a living will, and do you need both? We talked on this a little bit earlier. So the medical power of attorney is going to be the person or people that you name to be able to make your decisions should you not be able to make them on your own. A living will is going to be a document that talks about different emergency treatments that can be used toward the end of your life and if you would want them or if you don't. They can be combined in some documents. I've seen some documents where it has the healthcare power of attorney in the beginning and then living will later, but they can be different documents as well, but they cover 2 different things, the decision maker and then the decisions being made. So relationships and circumstances change. How do you revoke or make changes to your healthcare durable power of attorneys? So this might be the best news I have for you all today. It's actually pretty easy. If you decide at any time you want to revoke your power of attorney or you want to change the living will that you have, all you have to do is destroy the previous documentation and fill out new documentation and have all the major players around you know that you have changed it at that time. It's as simple as that. So you can do that as many times as you want to, honestly. For convenience sake, I would say not too many times, but you can. And like life changes, right? The person and the situation I am sitting in right now and the decisions I made for my end of life, should that present itself quickly, may be very different right now compared to 5 years from now. And I have to try to stay ahead of that and express to others what I would want. Can nursing home residents specify what treatments they want or don't want to extend their lives? Yes, as long as the nursing home resident is able to make their own decisions and they're considered to be in a legal capacity to be able to make those decisions, yes, they can make the decisions made known to someone around them and make an advanced care plan document that can exact those wishes for them. Now, if a patient has lost the ability to make their own medical decisions, at that time, it will fall on a power of attorney that they possibly have named before they went into the nursing home or when they got into the nursing home. If not, it would come under the Healthcare Consent Act that person would be the person, whoever it is in that Healthcare Consent Act, that would make those decisions for them. Should an advanced care plan be added to our medical record at the hospital? What about my medical provider? I always say yes. Anytime you're going to have any interaction with your medical care provider, you want to be sure you have the documentation with you. With your primary care provider, you can present it to them, they can scan it into your chart, and you probably won't have to bring it back again. When you come to the hospital, I would bring all my documentation with me or have my power of attorney know where that documentation is and easily retrieve it and bring it with you with them when they come. So I think multiple copies of the advanced care plan is always a good idea, having it available. But yes, always bring it with you and ask that it be scanned into your medical chart. Here at Spartanburg Regional, all of our offices are combined in one electronic medical record, so it can be easier for us to be able to see it should you share different providers across the system. So I would highly suggest you do that. So that's our last question. I want to thank you so much for joining me today for talking about advanced care planning. Like I said, it's a passion of mine. Please look at the resources we showed you earlier and peruse the website as often as you want to. Also, mylifemychoices.org is the state's website that covers a lot of advanced care planning topics as well, and you can peruse that as well. Thank you so much, and I hope you have a good rest of your day.